both we snore like anything. So we are more vulnerable for these ways.
Good evening, everyone. I'll be talking on the topic ocular blood flow in glaucoma. Till now, we are all aware about the most important modifiable factor in glaucoma is intraocular pressure. But now, since we have seen that the glaucomatous optic neuropathy occurs despite we have normal or low IOP. So why it happens? Because glaucoma is supposed to be a multifactorial disease. It is either IOP intraocular pressure dependent or independent. The newer theories related to decreased ocular blood flow, oxidative damages, exoplasmic flow, and genetic background also play a very big role. The vascular association usually is seen in cases where we encounter disc hemorrhages, peripapillary atrophy, stroke patients, in aging having atherosclerosis, systemic hypertension, and migraine. Coming on each one of these conditions, disc hemorrhages are usually associated with normal tension glaucoma, and these are associated with RNFL defects and location and size of peripapillary atrophy. These are indicative of rapid glaucoma progression. Next is peripapillary atrophy. This depends on the increased size of beta zone, which is also a marker of progressive glaucomatous damage in cases of glaucomatous optic neuropathy. The stroke. Glaucoma patients are usually seen to be associated with the stroke, and the common association is because of atherosclerosis in pathogenesis. Aging and systemic blood pressure is also found to have strong association. Various studies have shown metabolic syndromes such as hypertension and diabetes also found to be associated with glaucoma. Migraine is also a vasospastic phenomena showing retinal migraine and a critical risk factor for glaucoma. There are certain theory how the ocular blood flow is regulated. Like the normal blood flow in the body is regulated, ocular blood flow also have a regulation by the metabolic autoregulation, where the concentration of oxygen, carbon dioxide, potassium, hydrogen, and intracellular osmolarity also influence the vascular tone. The terminal arterioles are most sensitive to the vascular damages. Next is your myogenic autoregulation of ocular blood flow. Here the exact mechanism is not known, but the arterioles respond actively with the constriction because of the transmural tension which is seen in the blood vessel muscular walls. The neurogenic control of vessel is by the autonomic nervous system, which is by the adrenergic, cholinergic, and non-cholinergic and non-adrenergic nerve fibers. The humoral control of blood flow, as we all know, the renin is an enzyme produced by the GJ apparatus of kidney. This is also seen to occur inside the eye. And the same mechanism, it produces angiotensin II, which is a vasoconstrictor, and it also leads to the decrease in optic nerve head perfusion because of angiotensin II and leading to vascular ischemia. Another factor which is very important is endothelial vasoactive amines. So these are endothelin 1, 2, 3. Endothelin 1 is the most important amine which is affecting the vascular flow in the optic nerve head, and it in isolated ophthalmic artery it evokes potent contraction and seems to decrease blood flow to the anterior optic nerve. So the both things are interrelated, high IOP or vascular dysregulation. Either high IOP is because of the vascular ischemia, or vascular ischemia is related to high effect of high IOP leading to the mechanical damage and reduced blood flow in the optic nerve head, leading to glaucomatous optic neuropathy. These are all interrelated mechanism. So understanding of physiology of blood flow is of paramount importance in pathophysiology of glaucoma. So various studies such as early manifest glaucoma trial and collaborative normal tension glaucoma studies have come to a important discussion on abnormality in ocular perfusion, which is a prime concern in as a alternative mechanism in pathophysiology of glaucoma, especially normal tension glaucoma or low tension glaucoma. So another term which we should all know is ocular perfusion pressure. What is ocular perfusion pressure? This is defined as the mean arterial pressure minus the IOP. So mean arterial pressure is 2 into diastolic pressure plus systolic pressure divided by 3, which takes out the mean arterial pressure at the ophthalmic artery level. So all these are ocular perfusion, reduced ocular perfusion pressure is known to occur in cases of normal tension glaucoma or low tension glaucoma. So what are the methods by which we can measure the ocular blood flow? First of all, initial days, the Fundus fluorescein angiography, it is a gold standard for retinal narrowing, but it has limitation in checking the optic nerve head blood flow. It just provides a qualitative measurement of the superficial anterior part of the layer of optic nerve head blood supply. So it is not a very helpful investigation. The recent one is laser spectrography, that is LSFG. It is a non-invasive real-time technique. In this, the exact quantitative in vivo estimation of circulation in optic nerve head is seen. Though it also calculates the blood flow in optic nerve head, retina and choroid. The principle is based on a phenomena which is known as laser speckle phenomena, which is due to laser illuminating the surface of the blood vessels, and the blood flow, reduced blood flow or increased blood flow leads to blurring. So here we the parameter which we check is mean blurring. So here there is a Fundus camera which is equipped with the diode laser, and there are infrared CCD cameras and high resolution digital CCD cameras which takes the image of the optic nerve blood flow. So mean blur rate and the vessel index usually are checked in this, and it is color coded. Decreased blood flow is red in the lighter shade, cold colors, and increased blood flow is red as a warmer colors. This is a investigation showing LSFG. So coming, the newest investigation modality for checking optic nerve head blood flow is OCT angiography. This is a new 3-dimensional angiographic algorithm, and it exactly quantifies the ONH microcirculation. The indices read are reduced disc flow index, and it has sensitivity and specificity of 100%. So new here, recently many studies have been done. So in one study there is a comparison of mean blur rate obtained by LSFG is done with the OCTA findings, and it has been found significantly correlated with the reduced blood supply area in ONH tissue areas. Another study has found that OCTA vessel density has a higher glaucoma diagnostic ability compared to LSFG parameters in patients with normal tension glaucoma. So the studies have concluded that LSFG and OCTA both are useful tools for managing glaucoma. Another thing is color Doppler imaging. This is usually done by the, sorry? Okay. So to conclude, we have certain drugs also which have effect on increase in ocular blood flows, such as rho kinase, which is not a FDA approved drug till now. So to conclude, ocular blood flow is the future, and the clinician should have ability to treat blood flow abnormalities in the optic nerve head, which occurs even 10 years pre-perimetric stage. So in cases of normal tension glaucoma, the changes in ocular blood flow may occur 10 years before even the changes are seen in visual field. Thank you.
Good presentation. Rho kinase is now available actually. It has come in the market now. Recently it has been introduced in India also.